Good morning, Jill. Good morning, Jill. How are you?
I'm fine, thank you. Much better.
Across most of the UK, there's a growing trend to support adults with health and social care needs through a new kind of provision called reablement.
I do have a problem with squeezing this sometimes, actually, even now.
OK, shake it down first.
Reablement typically lasts up to 6 weeks, and the aim is to improve the independence of service users and thereby reduce the need for traditional care in the longer term.
With traditional care, the tasks were done for the person. With reablement, it's about re-skilling the person to actually give them the confidence to continue to undertake those tasks and to live independently. It significantly reduces the size of care packages, and savings that are made from that, it enables them to be used in other care services.
There are 2 reasons why local authorities have shifted towards reablement. It benefits service users and it saves money.
The advantages for service users, I think, are primarily around improving their quality of life, improving their independence and improving their dignity. But I think there are also many financial benefits as well. By maximising a person's independence, evidence shows that you can appropriately reduce the ongoing care they need. And as the evidence shows, that can last for some people for many months and even years.
Due to the more intensive support provided through reablement, the costs of the service are generally higher than traditional home care over the same period. However, research from universities, local authorities and internationally indicates long-term savings are significant.
The research, I believe, is very strong. On average, in some of the better performing services, we would expect to see 60% of people leaving not requiring home care. If you compare that with people who do not undergo reablement, only 5% will no longer require any ongoing support. So there is a major difference. But equally important for a large number of people is that approximately 30 to 40% of people leaving reablement, although they still need ongoing home care, their need is far reduced from that if they had not been through a phase.
The business case for reablement is to reduce demand for long-term home care services. I do want to emphasise, though, that the gains will be variable. Some people will make much greater gains from a period of reablement than others.
There's also no single model of reablement, and costs vary around the country. However, research does indicate a typical break-even point, after which most councils can expect to save money on the costs of traditional care.
The break-even point arrives at about 32 weeks. It shows that reablement does generate significant benefits, both in terms of quality of life, but also in terms of reducing the ongoing costs. Research has also shown that these results have been and are very capable of being replicated across a wide body of councils.
Central Bedfordshire Council has invested heavily in reablement. Over 70 trained staff work with people in their own homes. And recently they opened a new short-stay residential reablement service.
The business case for setting up Greenacres was pretty much based around the fact that we didn't think people were going out of hospital quickly enough. There was some delays in the hospital system, and we wanted to test out really what the intermediate care beds could provide for us in terms of both quality of services and efficiencies.
The first 6 months of results from the new 8-bed pilot at Greenacres have been encouraging, especially as a step-down unit to help patients leave hospital sooner.
From the customer's point of view, it means that they're not in an acute setting longer than they have to be, so they're not picking up other infections and actually becoming ill before they're actually discharged. From a social services point of view, or Central Bedfordshire point of view, we're actually preventing people needing long-term care by coming to a unit like this. So although initially it's very expensive, the long-term impact of somebody coming to a unit like this and then going on with reablement actually saves us money in the long term.
Yeah, that sounds very good.
Good.
In relation to the service that we've put in place, the break-even point was just over a year. And that deals with the capital investment that we needed, plus the service provision ongoing contracts. And thereafter, you start generating savings. But all of that needs to be reviewed in light of the outcomes that we're achieving. At the moment, the benefit is looking better than we anticipated.
Hey, here we go. 1, 2, 3. 1, 2, 3. Back again. Yeah, how's that? Oh, Shal can do it.
Out of the 41 people that we've had through this unit, there's been 34 people have been discharged out of Greenacres, and out of those 34, 29 have actually gone home to their own home. Statistics here are actually showing that this is working.
The savings are not solely confined to adult social care services. The reablement initiatives in Central Bedfordshire have also reduced costs in local health services.
We have evidence that we are able to facilitate far more hospital discharges through reablement, and the data is demonstrating that over the last 2 years that has really increased.
If you look at the whole system savings, you're getting people out of hospital significantly quicker, and you're also preventing people going into hospital. There's no doubt that this can save the commissioners a great deal of money if it's done in a whole system way, if it takes account of all the acute services as well as the community services.
Recent health and social care legislation means GPs are about to take responsibility for health service commissioning. Dr Curt is a local Bedfordshire GP who will sit on one of the new clinical commissioning groups, CCGs. A key change with setting health budgets is a move away from hospitals towards new alternatives.
It's got to happen because we've got an ageing population and we've got a huge growth in chronic diseases. And unless this happens, the NHS society, not just in this country but throughout the world, can't cope. So we have to give empowerment to people to manage their own conditions ultimately, with support from health professionals. So it's part of the way we're going to manage the health service in the future.
Reablement is part of a growing collaboration nationally between health services and local authorities. Of the 149 councils offering reablement in the UK in 2012, approximately 30% have some funding with the health sector. Central Bedfordshire is moving in this direction.
You're welcome.
We can see a whole system shift in the way we're thinking about future commissioning of these services, and you could ask, will we be doing this with health jointly in the future? And the answer would be absolutely yes.
I think it's also important to recognise that there are benefits for primary care here as well, and for the roles of GPs as providers of primary care and as people who run GP practices through, for example, perhaps reductions in prescribing, fewer falls, fewer demands on practice nurses, and all the other services that they provide in their surgeries.
It's a case of looking at the whole potential cost of care and also looking at sharing budgets. If social services and health can join up in appropriate circumstances, it's a win-win situation. But one has to trust. That's the problem, is perhaps in the past there hasn't been that trust between the two organisations. We're not talking about locally, I'm talking about nationally, and there's always this divide, social service, or has been in many parts, and it's a case of bringing that together, and it makes sense.
A closer working between health and social care will have benefits for the clients and for the various participating provider bodies. And it enables the Commissioner to ensure that they are gaining the maximum benefit for their population with a given amount of money.